Hi everyone, I am Dr. Vaishali Sharma, consultant gynecologist, laparoscopic surgeon and infertility specialist. Today we are going to discuss about an important topic which majority of the women they come to me and they ask me, and many of the times they don't have a clue how to proceed further. So whenever there is a pregnancy, the majority of the times they have the question, can they proceed with sex during pregnancy, during the first trimester, during second trimester, or how safe is it during pregnancy? So if pregnancy is there, definitely the first 3 months of the pregnancy are the most important and most crucial ones, because this is the duration when baby is settling in. The pregnancy has started to set in, and it will take a whole 3 months till the time the baby gets accommodated or gets settled completely inside your uterus. So mostly it is usually advisable to avoid an intercourse during the first trimester of the pregnancy, because in that case there can be a chance of bleeding or spotting or cramps, which will definitely increase the chances of miscarriage. Next comes if the pregnancy is natural or if it is an assisted pregnancy like IUI or IVF. Since a natural pregnancy, there is usually no problem in conception. The pregnancy has happened on its own naturally. Many a times a person or a couple doesn't face any problem, so they can continue with an intercourse or during the pregnancy, during first trimester also. But in case there is some difficulty like pain or cramp or spotting, any bleeding, then definitely you need to abstain from the intercourse till the time the first 3 months of the pregnancy have passed, especially if everything else is normal. Because many times when we get an ultrasound done, we get to know there is some placenta or which is low lying. It is very commonly found in the first 3 months ultrasound when we see that the placenta or the thing which supplies blood to the baby is located low in the uterus. So that means it is prone to have a bleeding, or it is predisposed to have increased chances of miscarriage in case any bleeding happens or in case any cramps start. So definitely first 3 months of the pregnancy are the most crucial ones, wherein it will be good if you avoid any intercourse during first trimester. Next comes the second trimester of the pregnancy. In that scenario, if your ultrasound says everything is normal, your placenta is located up in the upper segment, it is not low lying, and you have not experienced any complication during the first 3 months like spotting or pain or cramps or bleeding, then in that scenario, usually it is perfectly fine to have an intercourse during the second trimester. And especially if it is a natural conception, then definitely usually no problem. But if it is an IVF conception, again it is usually advisable to be a bit extra cautious, because it has been a tedious journey so far. So we usually advise if it is advisable to avoid it in case there is any slightest indication, like if there is any cramp or if there is any spotting, even in the second trimester of the pregnancy. And obviously, of course, if placenta is low lying, then definitely avoid intercourse during second trimester also, because placenta will take at least another 2-3 months to move upwards. You will be able to get to know about the actual location of the placenta in the second trimester ultrasound, that is called as level 2 ultrasound, usually done at the 20 weeks or 21 weeks. At that time you will be told that what is the actual location of the placenta. So if by that time it has moved upwards and you have not experienced any complication till now like spotting or bleeding, anything, then definitely again no problem in having an intercourse during this time of the pregnancy. Similarly, if we talk about the third trimester or the last 3 months of the pregnancy, again if there is no complication like a low placenta or anything like cramps or any spotting or any placenta excreta or any fibroid in the uterus, any kind of complication, if nothing is in there, only all this thing has been, all the journey so far has been okay, and your ultrasound is perfectly fine, then again definitely there is no problem in having an intercourse during third trimester of the pregnancy, because it actually helps in setting in the labor also. So once you are in your last trimester, you can definitely have intercourse, and in that case it will actually help you to have a normal labor, initiation of the labor at that time, and it will actually help in having a normal delivery. So far we have discussed when and how you can have an intercourse and when you should avoid definitely. So if you have any other query regarding this thing, you can leave your questions in the comment section. You can subscribe to our channel for regular updates, and you can always share this video with any person who is in need of this information. And thank you. Take care. Bye.